So tonight we're going to be doing a full general checkup. Is that right? Wonderful. So if it's okay with you, I'll begin by just checking your heart and your lungs and your blood pressure. Okay. Okay. So I'll just come a little closer if that's okay. So just breathe normally for me. Okay. Good. I'm just going to come around you and just listen here at the back, if that's okay. Just nice deep breaths for me. Nice deep breath. That's it. Okay. Okay, good. All right, good. So I'm going to check your blood pressure, right? Okay. So when was the last time that you had your blood pressure checked? Okay, and were there any issues? Let me just roll up your sleeve a little bit. Okay. All right. So just take a nice deep breath as normal. You can close your eyes if you wish. Okay. Okay. So let me just take the cuff off you. Just very gently. Okay, so that looks pretty good. I'm pleased with the blood pressure. Okay, no issues there. Okay. So the next thing I'm going to do is I'm going to examine the skin around your scalp. Okay, and I'll have a closer look at the skin on your face as well. Paying particular close attention to the skin on your hairline and any of the areas that are prone to sun exposure, okay? Alright, good. So whilst I'm examining your skin, I'm going to be using a little flashlight like this, okay? Alright, so I'll just be using that to focus on certain areas. If it's okay, I'll come a little closer. Okay. Alright, good. So let's just have a look here at the scalp. Just checking here. Okay. Checking for any slight irregularities. Okay. So I'm just going to part your hair a little bit, if that's okay, just to check here. Yes. Just checking this bit. Okay. Looking around the side. So I'm just going to move your hair a little bit, if that's okay. Okay, and I'm just going to check here behind your ear, if that's okay. Just to make sure that that's all fine as well. Okay. And if I can look behind your ear on this side as well. Okay. Okay. So I'm going to just take a look at the skin on your face, okay? Just use my little light here just to shine a light on some different areas. Okay. Just look here. That's okay. Okay. That's it. Okay. Good. Can you open your mouth for me? Say ah. Okay. All right, that all looks nice and healthy. Okay, good. So I'm just going to check your posture, okay? So just nice and relaxed for me. Okay. Let's have a look here. Okay. And just stand nice and tall for me. Okay. Good. Have you noticed any back pain or anything in the recent? Okay. Any neck pain at all? So I noticed that you're holding tension in your shoulders. And sometimes the one shoulder is slightly more elevated than the other. So that's quite normal. And perhaps we could just work on some conscious relaxation exercises where you're actively relaxing the shoulders, okay? Alright, it's nothing to worry about. If it does cause you any concern, then I can refer you to a specialist and we'll have a deeper look into it. But for now, it's not a worry, okay? Okay, so the next test that I'm going to do is a sensation test, okay? So I'm going to be testing the sensations of sharp and soft. Okay, sharp and soft. So I am going to just lightly touch the end of each onto your cheek. Okay, and I want you to tell me if you feel sharp or soft. Okay. Okay, so sharp, soft, good. Sharp, good. Soft, okay. Soft, good. Sharp, very good. Sharp, Sharp, very good. Soft. soft. Okay, excellent. And soft. Okay. Good. Well done. So the next test that I'm going to do is I'm going to be examining your ears, okay? So I'm going to be using my otoscope, and the first thing I'm going to do is I'm going to examine the outer structure of the ear, okay? So I'm just going to have a little look here and just ascertain whether there's any changes, anything to be concerned about. Okay. If I just move your hair out of the way. Alright, so I know that in the past, from your notes, that you've had some issues with your ears. Yeah, so with some earwax build up and feeling a bit blocked, a bit clogged in your ears. Have you noticed that there's been any improvement? Okay. Okay. Have you noticed that there's been any deterioration? Just going to grab my tweezers, okay? Okay. So while I'm here, I'm just going to remove a little bit of earwax for you. Okay. So I'm just using the little magnifying glass, and I'm using that to help the precision of these tweezers. Okay. Okay. Let me do the other side. Okay. All right. Okay. Good. So I'm going to take a closer look inside your ears with my otoscope, okay? So I'm going to come a little closer. Just have a look inside. Let's take a look at the other side. I can see that you have had some trouble with your ears in the past. Okay, so I can see that you are still recovering from an ear infection. Yeah, so the infection has left some residual inflammation in your ears, but I'm not concerned about it at this stage because I can see from your notes that you have had a thorough antiseptic and antibiotic ear cleaning. Okay, alright, but it certainly looks like it's on the mend, so that's positive. Good. So I'm going to do a one hearing check, okay? I'm going to whisper different words in each ear one at a time, and I'm going to repeat those words, and I want you to tell me when it is that you can no longer hear what I'm saying, okay? Alright, so let's start. The first word. Buttercup. Good. Okay, the next word. Coconut. Okay, good. Okay, the next word. San Francisco. Okay, good. Okay, and the last word. Cincinnati. going to test your eyes, okay? I'm going to be shining my little pen light into your eye, and I'm going to be observing the health of the surface of your eye, okay? So do your best throughout to look behind me if possible. So look at the wall behind me and don't look directly at the light, okay? Good. It's going to come a little closer. Just real closer as well. Good. Okay. Just keep looking straight ahead. Okay, I'm just going to come a little closer now. Good. Good. Okay. A little closer. Good. Okay, so you can blink just for a moment. It's okay, good. So just look up for me. Okay. Yeah. Good. Keep looking up for me. Okay, and look down for me. I'm just going to lift your eyelid if that's okay. Good. And the other side. Look down for me. Okay. Good. Okay, good. So if you'd like to focus on the light now and just follow the light for me, okay? So up and down, up and down. Okay, good. And left to right. Good. Let's do that one again. Just follow the light. Good. Good. Okay. And let's do one more. So we do triangle, diagonal. Okay. Good. Okay. Can you feel the light for me? That's it. Okay, good. Alright. Good. So you can just close your eyes for a moment, just to rest. Okay. Good. So I have here a series of shapes and colors. Okay. So I'm going to ask you to trace the shapes with your eyes by following the light, okay? So let's start with the first one. Okay, you ready? Good. And what color is this? Blue. Very good. Okay, let's do the next one. Okay. So this one is a little bit more difficult to see. Okay, so you trace this shape with the light. Okay, just follow the light. Okay, good. And what color do you see here? Red. Very good. Okay, so we have one more. So what color is this? Green. Very good. And if you'd like to follow the shape, please. Okay. All right. Good. Well done. Okay. So I'd like to do one more sensation test. Okay. I'm going to be testing your ability to discern the different fragrances. Okay. So for this, I'd like you to close your eyes, please. That's it. Okay, good. And I'm going to place a fragrance under your nose and ask you to tell me what it is that you smell, okay? Alright, so let's do the first one. Okay, so what is it that you smell? Lemon. Well done. Okay. Good. So, again, keeping your eyes closed. And what is it that you smell? That's correct. Well done, lavender. Very good. Okay. So because our olfactory senses are all linked, our sense of smell is closely linked to our sense of taste. I'm also going to give you a taste test, okay? So I'm going to place a little dropper of a taste under your tongue, and I want you to tell me what it is that you taste, okay? Good. So okay. So open up for me. Okay. And one more drop. Okay. What is it that you taste? It's grapefruit, correct. Good. So that's bitter taste. All right. Good. Okay. Let's do the next one. Okay. All right. Open up for me. Okay. And one more. Vanilla. Good, well done. Okay, very good. Very good. Okay, so that concludes your full checkup with me this evening. Okay. I'm very happy with all of the test results. You are in good health. And it's very nice to see you again, so take good care of yourself, get good rest, and I will see you again soon, okay? Alright, bye bye for now.